Folks, this is Steve Adubato for JFKTV. This is one of the interviews I've really been looking forward to. This is Elaine Kilijanski, who is a paramedic with the Mobile Intensive Care Unit, right?
Yes, I am.
Now, we are looking at, I've been looking at this vehicle, and I have no idea how special it is, except everyone tells me it saves lives. Elaine, help us understand that.
Well, this is the MICU. We've been, in service for the Edison area for almost 3 decades. And what we do is we bring the emergency room to your home, to your place of work, to the Route 1 accident. No matter where, we bring the emergency room to you.
Tell us, Elaine, what we're really going to see.
Okay, inside the rig itself?
Yeah, tell me what's
okay, a lot of different equipments. We have the state-of-the-art EKG. We also have all different medications. We have IV equipment. We have the pumps. We have respiratory equipment, state-of-the-art, with the new glidoscopes for intubation, which is a state-of-the-art to get people on ventilators quickly to assist in their breathing. So when we bring them to ER, we work right with respiratory to keep the system going, just one straight line.
Well, you know what's really interesting is we've talked to a lot of clinicians here at JFK about stroke prevention, stroke care, right? Give me the connection, Elaine, between the MICU and stroke care, because time is critical, right?
Well, time is brain. The main thing we're looking for is to know when we get there, when did the stroke symptoms start, because it's the first it's a leading cause of disability in the United States, and it's the third leading cause of death in the United States. So time is important. We have a window, so we need to immediately get the phone call to 911 for us to come out to treat you, because we have a 3-hour window for treatment. So you got to be able to recognize the signs and symptoms of a facial droop, slurred speech, blurred vision. And the main thing, we need to know what time it occurred so we can get you here. And then we start our treatment. We give a complete assessment on the scene. Both EKGs, we do blood sugars, we initiate IVs. We call into the hospital to get the doctor to know that we're coming in with a code stroke. That initiates the neuroscience team here to immediately meet us in the ER so we can get the patient from ER door to CAT scan in under 10 minutes. That's the goal. And then to have treatment initiated.
Hold on, Elaine, this is all before the patient even gets here to JFK?
Correct. Everything is done by, we call into telemetry to the docs, and they know. We have the radios, and we can even send them 12-lead EKGs. We tell them what's going on with the person, because they could be in atrial fibrillation, which is a leading cause of a stroke. When we do the EKG, we can send that to them over telemetry. They see it before we arrive.
How exciting is this for you? You've been a paramedic for how long?
15 years I've been a paramedic.
What has this MICU, the Mobile Intensive Care Unit, done for you as a paramedic?
Well, it's rewarding. It's rewarding, it's exciting to me, because we see instant results. We have a lot of patients that we can treat, and they could be unconscious at the scene, and we start a lot of different treatments, and sometimes they're talking to us when we arrive here. There's a lot of good learning tools here too, and it keeps you on your toes, because you have to notice the latest equipment, and you have to understand the treatment diagnosis and where you want to go in the next step.
Exciting time here at JFK now.
Absolutely, because we are the Neuro Institute.
You're good at this.
Yes.